Unlike most neurological diseases, brain infections can actually be treated. But to get patients on the right treatment, you have to get the diagnosis. And making the diagnosis can be difficult. Without the diagnosis and the right treatment, the consequences can be devastating.
In India, many of the brain infections, they are diagnosed very late. They don't get the treatment on time, and so the outcomes are poor.
Brain infections have been a big problem in Brazil, especially with the entrance of Zika virus. So we have observed many newborns with brain infectious diseases.
Brain infections in Malawi are common, so we desperately need a support program that will help improve early diagnosis and care in Malawi.
The aim of our pioneering research at Brain Infections Global is to stop people dying unnecessarily from brain infections and significantly improve patient outcomes worldwide. At Brain Infections Global, we've partnered with other organisations in the UK and research institutes in Brazil, Malawi and India in order to develop a structured framework that will create a long-term sustainable solution to this difficult problem. The programme operated through 5 themes. The first was to understand why diagnoses were not being made. What was the problem?
We worked in 13 hospitals across 3 countries, collaborating closely with doctors, nurses, and patient groups to understand the social and structural barriers to diagnosis and treatment.
The second theme was developing an intervention to improve diagnosis.
We looked at where the delays in diagnosis happen and, as a result, introduced a simple lumbar puncture pack, which has greatly improved the percentage of patients receiving a diagnosis.
The third theme was to develop new approaches so that we have better diagnostics in the future. The fourth theme was around health economics and policy. The interventions that we introduced had to be cost-effective so that they could be sustained in the long term. And finally, there's a large training and capacity building programme so that, again, all of this work is not lost at the end of the programme but is sustained into the future.
We enhanced diagnostic laboratories, streamlined patient assessment, and provided training modules as well as e-learning modules to help in dissemination and improve the skills of doctors, nurses, and laboratory technicians worldwide.
Overall, our programme has significantly improved patient care in these lower and middle income countries, ensuring quicker diagnosis and life-changing outcomes.
I think it's been a real privilege to be part of a program where we actually improve things for people in real time. Often research thinks about 20 years ahead. What we've managed to show is that this simple intervention can improve patient care, and it's really exciting.
I thought it was a good program. I really liked the fact that it involved the district and rural hospitals and got them talking with the teaching hospital, and also incorporating the lab and getting them to talk with the clinical people. That really makes a difference.
So the changes that we've made are actually changes that are simple, they're cheap or affordable, and can allow us with those interventions to actually improve our outcomes and to save lives as well.
With the support of a huge number of clinical and healthcare teams, I'm incredibly proud of the work achieved so far as our research continues to make positive impacts across the globe for people suffering from brain infections.